Knee repair, not knee replacement is a multifaceted thing. But to answer the short answer to that question is absolutely it can help someone who has bone-on-bone arthritis. It is not going to make that bone-on-bone arthritis back to when that person was 18 years of age. We can't do that. Nobody can do that. I don't care where you go throughout the world. I've been all over the world. No one's doing that yet. If you could do it, everybody would be doing it, right? It can't be done yet. But we can perhaps, we talked about, I think this has been a really good session. You might be able to grow a little bit back. You'll be able to hopefully optimize the cells that are still in there to produce more matrix, get the swelling down, get the inflammation down, get the muscle stronger, get the fat out of the body, maybe lose some weight if you need to lose weight, anti-inflammatory diet, all these different things. And then including the regenerative, whether you got to take care of the bone, because a lot of people have bone on bone and have pain. You got to get that MRI and it's going to show the stress microfracturing in the bone and just taking care of that. We have a few minutes here, but there's an amazing study. Dr. Philippe Hernigot, orthopedic surgeon in France, late 90s, early 2000s. He has 140 patients, and his theory is that as we get older, we have less good stem cells in our arms and our legs and our extremities, but we still have really good stem cells in our back, our spine, and in our pelvis. Now, no one wants to take stem cells from the spine if they can help it, but the pelvis is right underneath the skin in the back here, not our back itself, but in the lower area here. And the pelvis is very accessible and it still has a lot of good stem cells in it. And stem cells are cells that can turn into other cells. But as we also earlier talked about in this hour, they can help tell other cells what to do and help remodel the inside of the joint. So it's more, we'll get into this some other time too, how we're really remodeling the joint. We're not necessarily making it a brand new joint, like making it brand spanking new, but we're remodeling it, making it better, just like that show Fixer Upper. The house looks crappy, feels crappy, doesn't function well. It has a lot of quirks to it. Chip and Joanna come in, they can do the work themselves. They're kind of like the boss cells, but they tell their team what to do. Their team comes in and their team remodels the house. So now it looks better, feels better, functions better. It still has a few quirks, but not as many as it used to. It's still the same house, but it works and functions a lot better. That's how knee repair, not knee replacement works. And so we'll get into that more at some time in the future, but the answer is yes, it can absolutely help plenty of patients who are bone-on-bone arthritis, and we've done that multiple times. And regarding Dr. Hernigot, he had 140 patients. They had really bad arthritis in both knees, bilateral knees. So they were told they needed a knee replacement in both knees. You need a knee replacement in both knees. So he said, okay, we're going to do a knee replacement on one knee, and we're going to do the stem cells on the other knee, and we're going to inject it into the bone where the problems are, where these stress microfractures are. So they had a minimum follow-up of 10 years, 10, maybe some of them 15 and 20 years. And at the end of the day, 82% of the people who got just the little poke holes, the little shots of the stem cells into their bone, never needed a knee replacement for 10, 15, 20 years. So if I told you you have bone-on-bone arthritis and you asked me that question and I tell you, if we just did that, and we do more than that, by the way, if we just did that, you got an 82% chance of never needing a knee replacement for 10, 15, 20 years. Would you take that?
Absolutely.
You can ask that. I don't know if they're on the. You can ask them that question or right back. But that's the question. That's the question. And we do more than just that. So we do a program. That's part of our program. Just doing that. But that study was an amazing study. And those people, 82% didn't even need a knee replacement. And by the way, the people who got, I mean, the other knee, because they all got at least one knee replacement. They all said their non-knee replacement knee felt more normal. It functioned better. And the knee replacement knee. 15% of those in that 10-year frame needed another one. So they needed two huge surgeries. And because metal, plastic, and cement wears out. Once you get metal, plastic, and cement, you've got it for life.